Um, but so excited to see you all today. I've been in the works with this little learning session webinar for a while, but welcome. This is the Ohio Spotlight, lessons learned from a cost-benefit analysis of lead pipe removals. Um, you all know the day, it's March 26th. If you haven't already, while you wait, please introduce yourself in the chat. We'll also have a little post-learning session survey. It's very short. Please fill it out if you're able to. It helps us a lot to know how to improve, myself especially. Um, just going to give myself a quick introduction because I realized I didn't make a slide for that, but my name is Shelby Klein. I'm the Drinking Water Program Associate at River Network. I live right outside of Denver, Colorado, on Arapaho, Cheyenne, and Ute land. And yeah, I'm really glad to be here. It's sunny. I'm pet sitting with some dogs, and we're having a good time. Uh, River Network is a transformational national network of water, justice, and river advocates. You may know us or be connected through River Rally. We do every 2 years. Our next one is in San Antonio, Texas. Pull up. I would love to see you all there. And we envision a powerful and inclusive movement that ensures abundant, clean water for all people and nature to thrive. We believe that joy and hope for our planet flows through our rivers. And I really love that sentiment of joy and hope, especially in times where it feels like things are a little stressful and a little hard and a little uncertain. So, joy and hope is what keeps us going. If you want to learn more about us, please check out riverNetwork.org. But I feel like you're probably already a little connected if you found out about this webinar. Today, I am so excited to introduce our speakers. We have Annalisa and Rob. Annalisa is the drinking water manager for Ohio Environmental Council. She leads the policy efforts to ensure access to safe, clean, and affordable drinking water for all Ohioans. With a strong background in environmental policy and economics, Annalisa works closely with lawmakers, government agencies, and stakeholders to advance legislation and initiatives that protect drinking water throughout the state. So this is right up her wheelhouse. She graduated from Michigan State University with a degree in environmental economics and management. And while she was there, she piloted an intern program with the university's Office of Sustainability. And as somebody who did an intern program with their sustainability office, I know how valuable that is. So way to go. That's awesome. Rob Moore is the principal for Scioto analysis. He has worked as an analyst in the public and nonprofit sectors and has analyzed a diverse set of issue areas such as economic development, environmental education, or environment and education, two separate things, and public health. His specialty is applied microeconomics analysis, which I don't even know what that means, but it's awesome, and public policies and trade-offs between efficiency and equity outcomes in economic development and social safety net programs. He holds a Master of Public Policy from the University of California, Berkeley's Goldman School of Public Policy and a BA in philosophy from Denison University, which I believe is in Ohio. So yes, we are so excited and lucky that they were able to come on and do this with us today. But before we get to hear them talk, you get to hear me talk a little bit at you about lead and what's happening on the federal level. So I am going to give you just a little bit of background about like the current state of things. This is a big topic. It could genuinely be its own subject, expertise, course, semester, seminar, it could go on and on. But lead water pipes, lead service lines, as they're kind of known more in the space, is a diverse issue. You might have seen a lot in your local news. You might be working with it. I think there's a lot of advocates on this call. You might be working on it for work. But just as a recap and a nice little refresher for everyone, on October 8th of last year, the EPA released its final rule for the lead and copper rule improvements, which we have all kind of fondly shortened to LCRI. I'm generalizing a bit, but the final rule received a fair amount of praise from advocates who wanted there to be stronger protections from lead exposure in drinking water. A lot of the opposition stemmed from worries from water utilities and in just industry generally around the funding and timing aspects, both in terms of the feasibility of inventorying and replacing the lines. The rule specifically created a 10-year timeframe for replacements, although for certain systems like Chicago, that timeframe was actually expanded with potential extensions to upwards of 20 years. You know, in places like Chicago, there's a lot of lead pipes, and so I think the logic there was just to get them more time, but a bit contentious. Um, Another requirement of the final rule that I wanted to mention is it has a lower action level of 10 parts per billion, which is a really great improvement from the previous action level of 15 parts per billion. Um, if you don't know what an action level is, essentially when a water system tests its drinking water for contaminants, in this case lead, certain thresholds trigger different things. For an action level exceedance, certain action steps must be taken, kind of like the name suggests, such as reviewing the system for sources of the contamination. One new addition is the requirement to provide at-home water filters if the action level is triggered 3 times or more within 5 years. Beyond the action level steps, however, water systems are also required to offer to test schools' drinking water, but they're just required to offer. So this is overall lacking in comparison to some other states. We did a webinar on this last year, but like Michigan's Filter First law was created to protect schools and childcare centers. Children in particular are very vulnerable to lead. So by filtering the water first, it's a more of a precautionary sort of approach. And children, because they're developing, can have really severe adverse health effects on their well-being when they, have high levels of lead. And it can come from different sources. I think another place we often think about it is with lead paint. So despite the progress that this rule presents for public health and environmental justice, and perhaps, sort of the bipartisan nature of making sure all your constituents are protected from something preventable like lead exposure in drinking water, there have been a couple of proposals for a Congressional Review Act, or CRA, to revert the LCRI back to its previous Trump administration's rule. So this has kind of been a long rulemaking sort of process, but that was called the Lead and Copper Rule Revisions. To put it lightly, this is kind of a no take backs, no takesies backsies sort of approach, and it would prevent future regulations from implementing the same or even similar improvements that the LCRI currently does. Both of the resolutions that would implement a CRA from representatives in Alabama and Georgia, respectively, shout out to my home state, have only been introduced and have yet to move through the House or Congress at all. So I'll stop yapping, but all in all, there's a lot to lose and, even more to gain in benefits. So many advocates are working hard individually, legally, and through partnerships and coalitions to continue pushing for those stronger regulations around lead service lines, which, in my opinion, is a really great segue into the state level work, cost benefits, that today's speakers are going to talk about. So I will pass it over to them.
Awesome. Thank you so much, Shelby. I think I'm up first. So I'm going to start by talking a little bit about what's going on in Ohio and then how we came to want to get this cost benefit analysis report done. So Ohio currently ranks third in the nation for the most lead service lines, with an estimated 745,000 lead lines still in use, delivering water to homes, daycares, schools, all over the state. It's something like Ohio has 3% of the country's population, but over 8% of our lead service lines are in Ohio. So the Ohio Environmental Council Action Fund has been working on state level legislation for the last couple of years that requires all public water systems to fully replace their lead lines within 15 years. So this legislation is designed to work in tandem with the federal lead and copper rule improvements that Shelby was just talking about. The timeline is a little bit different. So we came to this 15 years versus 10 for a couple different reasons. One, the political landscape in Ohio would not pass a 10-year timeline. And so we thought 15 was a good um, it was a good compromise here because there are cities like Cleveland. Cleveland ranked second in the entire country for the most lead service lines in a city. There's over 200,000 lead service lines just in Cleveland. I think they are just behind Chicago in that list of cities. And so we found that 15 years is aggressive, but achievable for Cleveland. So most of Ohio will be bound by that 10-year lead and copper rule timeline, assuming it does not, get rescinded in any way. But this does create that commitment that Cleveland will have a maximum of 15 years to get their lead lines replaced because they do qualify for extensions under the lead and copper improvements rule. So we've been working really closely with Assistant Minority Leader and Representative Dontavius Gerals. He's a Democrat out of Columbus. He actually has a personal story of lead poisoning. He was a child who got lead poisoning from his kitchen table at his grandma's house. So this issue is really near and dear to his heart and something that he is all in for. So Representative Gerald does sponsor this bill. We've been working with him to craft it over the last 2 years. And we were in a strategy meeting one day as the bill was getting ready to or we were a couple months out from introduction. We were getting close to finalizing all the language in the bill. And so we're starting to talk about tactics. How do we get the word out? What is our strongest messaging and all of that? And Rep. Gerald's asked us a really important question. If we can go to the next slide, please. Rep. Gerald's asked us, what's the cost of doing nothing? And that made us all stop and think. And we were like, that's such a great question. We can sit here and talk about the health effects all day and the symptoms and what happens to children and adults from lead poisoning, but how can we quantify this? We need to really create messaging and arguments that reach across both aisles. And so so we set out to answer this question. And that's when I met Rob and we partnered with Scioto Analysis to get this question answered. So I think next slide, and I'll kick it over to Rob.
Thank you, Annalisa. So, Scioto analysis is a public policy analysis practice based in Columbus, Ohio, and we have analysts who are in different parts of the country, and we focus on, like, we've been doing cost benefit analysis for since about 2019 now, and cost benefit analysis is not something that's used widely in Ohio at the state level. We did a study in 2019 on the prevalence of the use of cost benefit analysis, and after searching all of the websites of all of the major agencies, after sending surveys to major agencies, to universities, to think tanks across the state, after doing a number of interviews, we couldn't identify a single best practice cost benefit analysis that had been done in the past 11 years in the state of Ohio. So we've been doing demonstration cost benefit analyses since then to show people how this can be done. And I can say that that number has improved a lot since that point. So we've been having conversations with folks like the Ohio Environmental Council about this. We did a study a few years ago with them on the cost of climate change for local governments, and that's kind of what got us connected in the first place. But as we got into this cost of doing nothing question, I was like, this sounds like a cost benefit analysis to me. And what we wanted to do with this study was we wanted to look at the status quo of what would happen if a portion of lead service lines in Ohio are replaced either by the H2 Ohio program, which is basically a program that funds a lot of water programs in Ohio, the Federal Infrastructure Act, which funnels some money through the H2 Ohio program, actually, or other funding. And then we wanted to compare that with this replacement proposal that was put forth by Rep. Gerald's, sponsored by OEC, on replacing every lead service line in Ohio over the next 15 years. So we can go to the next slide and talk about that. The good news is we had a little bit of a foundation that we could build off of with this. For those of you who are real lead service line geeks, you might recognize these people. This is Ronnie Levin and Joel Schwartz, who are two researchers at Harvard University who did a study on the costs and benefits of lead service line replacement and the federal lead and copper rule. And they built off of the cost benefit analysis that was done by the EPA. And then they basically said that there are some costs and benefits that were being overlooked in that they wanted to cover in that. So we used their study of the federal program in order to do our study, adjusting a lot of the results that they got. We're basically a lot of our goal this kind of analysis is to stand on the shoulder of giants, and I see these folks as the giants that we're able to stand on for this. So let's go to the next slide and talk a little bit about what we found and what we addressed. So in their study and in our study, we were able to look at a number of different benefits. Basically, what we split this up into is 3 categories. That's mental benefits, physical benefits, as well as infrastructure benefits. And then we look at costs of the program. So we looked at the benefits of decreased ADHD, decreased dementia, decreased depression, increased IQ, some of the physical things like decreased anemia, decreased coronary heart disease, decreased cardiovascular mortality and infant mortality. And then we also looked at how much water waste would be saved. And then we looked at the costs that would come for replacement to consumers, like customers themselves, the end users of water, and then also the cost of pipe replacement to utilities. So let's go on to the next slide here. And I'll give you some of the results. So this is our big table of results. You can find this in the study. If you want to look at the study, it's on the Ohio Environmental Council website. You can see the benefits that what we did was we quantified the benefits, which you can see in this middle column here, and then we monetized them and put dollar figure benefits on each of these. Some of the ones that are probably worth drawing the most attention to, if you look at the decreased cardiovascular mortality, that's about an estimated 9,700 deaths from heart disease that will be prevented under our base model. And that has a monetized benefit of $66 billion. But you can also see impacts on depression cases. Average IQ point for 290,000 children would be impacted. You can see 650 infant lives saved because the infant mortality impacts. So yeah, you can see a number of different benefits here. Also pretty sizable water waste benefits. On the cost side, we used estimates from the EPA to make some estimates for what the total cost would be. Still it's a pretty sizable number, almost $5 billion. And this is kind of what Rev Gerald's was talking about. It was like, okay, we hear the costs on the cost side of it, but what's the cost of doing nothing? And that's really what this benefits side is saying. All of these, that $160 billion in benefits that you see up there, that's what we have to pay if we don't replace these service lines. Then at the bottom, you can see our overall impacts, $160 billion and 31-to-1 benefit cost ratio. So let's go to the next slide here. This is just a visualization to give you a general idea. We like to use these tree maps sometimes as a way to see how the benefits apply to the costs. It's also kind of a nice way for you to just take a glance and do some kind of back of the envelope sensitivity analysis. You can see here decreased water waste is a massive benefit when it comes to how much could be saved, because a lot of these pipes are very old and there would be a lot of leakage that goes with this. But also, even if you take that out, you have such huge benefits from the decreased heart disease. Even if you take the decreased heart disease, we still get a positive benefit cost ratio when it comes to how much benefit would come from increased IQs. And how we monetize that is increased IQs end up leading to higher wages down the road. And then that has economic benefits that comes from people being able to make more as they develop. So you can see these costs to property owners and ratepayers, which is basically a replacement. Cement costs can be outweighed by a lot of these different benefits. And let's go to the next slide. To take a look at what our overall return on what our overall benefit cost ratio looks like under different scenarios, we did a Monte Carlo simulation, which is a fancy way of saying that we varied a bunch of the different estimates to see what would happen under different scenarios. So we did 10,000 simulations and varied some of our inputs on dimensions like the ratio used to adjust to local conditions in Ohio versus the national study that was used, the dementia rate, value of a statistical life, decreased water waste differences, cost per lead pipe replacement. We had a range of potential lead pipe costs that we tested. We also looked at the number of lead pipes as one of our ways because we don't know exactly how many lead pipes there are in Ohio. So we varied those too. So on our next slide, I can show you some of the results of those simulations. So what you see here is the 5th percentile, the average, and the 95th percentile of benefits. I mean, of the outcomes we did. So basically, what you can think of is the 5th percentile is kind of a low end estimate of the benefits in our simulation. The average is our middle estimate in the simulation, and the 95th percentile is a high end estimate. And you can see that the net present value ranges anywhere from $140 billion to $180 billion in benefits to the state of Ohio. Benefit cost ratio ranges anywhere from 32 to 45 to 1. We do a lot of these studies, and these are very large numbers. These are large numbers on not only like a scalar level, like these hundreds of billions of dollars. A lot of state programs that are very meaningful don't go up this high, but also from a benefit cost ratio. I mean, these, even though it is costly, it is billions of dollars to replace these. The benefits are very, very large. You're getting so much benefits back for that investment. Um, you can see the range of heart disease prevented going from 8,100 up to 9,600, and our higher versions, coronary heart disease cases prevented, also depression cases. You can see the results from those. So those are some of our simulation results. Go to the next slide. And we also did a little bit of sensitivity analysis. So we did some sensitivity analysis to say, like, okay, what if we put in very pessimistic results? Because these results are so big. Let's just dial everything in the most negative perspective we can to see what happens in a worst case scenario. We still came up with a 23 to 1 benefit to cost ratio. Um, what if we just take out deaths? What if we just say, like, we're not even going to put any value on lives saved? We still get an 18 to 1 benefit to cost ratio if you don't even include those health impacts. If we take out the water waste as one of our impacts and just said we're not going to count any of the water waste in that, we still get a 16 to 1 benefit cost ratio. So a lot of these are really showing just how big these results are, and if you slice it a lot of different ways, you still end up with very large benefit cost ratios for this for this program. Okay, next slide. We also did one more sensitivity analysis I wanted to share with you, and this was a, a sensitivity analysis around the speed of the phase-in. So basically, what we've got here is to say, what if we do this phase-in slower or faster? So with the if we front load I mean, let's say we just did, well, actually, in our base one, we just said that these are in our base model, we said that the lead pipe replacement happens at an equal ratio throughout the 15 years. So it just happens equally. What if it takes 5 years to get the first 20% done? Benefit cost ratio drops to 28 to 1. If we wait 8 years for the first 20%, if we push it back, then we get a 22 to 1 benefit cost ratio. And if we only do 20% in the first 10 years of those 15 years, we still end up with an 18 to 1. So obviously you get more if you do it quicker. If you do the replacements earlier, then we're able to start getting those benefits more quickly. But there's still some pretty big benefits, even if we do it at the end of that territory. So I think this shows trying to get on top of this more soon is better, but we can still get benefits if we do it later. We also made an extremely conservative estimate where we were really just looking at the benefits that happen during the time period of the replacement. And a lot of these benefits are going to be accruing for years and years in the future. So these numbers could be even higher if you look at a larger time window. I have seen some questions here, but I think I'm going to just leave them till the end just so we can make sure to get to everything in the program. But I do want to come back to these as we go through, just so I don't monopolize our time at the
Yeah,
end.
Rob, I just said so people are thinking about them, but I said we'll do them in order for the Q&A at the end.
Okay, thank you, Shelby.
Yeah.
All right. Um, Next slide. And I think that's the end of mine. Yes. So I'll hand it over to Shelby now.
I was muted. Thanks, Phil. Okay, we are going to take a quick break so you're not just looking at PowerPoint the whole time. Um, and we are going to do a little poll. And I'm going to launch this. It's going to be out on your screen. Feel free to, maybe don't select all of them, but feel free to select what feels most relevant to you. But the big question is like, what, from what you've learned so far, like what interests you the most about this Ohio study? The options are the cost of doing nothing, like that sort of notion. What Annalisa was talking about, like working and talking with state legislatures to even have those conversations to begin with, the process of conducting a cost benefit analysis, and Rob's done like an excellent job of explaining some of the ins and outs of the technical side of things. We haven't really gotten to a lot of it yet, but like OEC and how Scioto like began working together, they met and they've created this wonderful partnership. And also this aspect of building a trusting, effective partnership. Um, okay, it looks like we've got a few answers so far, about half. Um, it's been about a minute. You don't have to rush. We have a second. But it looks like the process of conducting a cost benefit analysis is slightly in the lead. People are also interested in the trusting effective partnership piece and the cost of doing nothing. I think this crowd is maybe not as interested in talking with state legislators, because I mean, I get it. That's fine. There's a lot to that. Um, yeah, okay. This is cool. Okay, we still have about 10 people who haven't answered. So if you want to, I'll give it another second. Um, I'll just go ahead and ask Annalisa, Rob, what would you answer on this if you haven't? You want to share with the audience, the crowd, the class?
Yeah, for me, I definitely was super interested in like the cost of doing nothing, right? Like that
Yeah.
is, um, it is what I needed for this project, but I mean, I use this every single day when I talk about lead, and I'll get more into that. But the idea of the cost of doing nothing is something that we are starting to now put into more of our advocacy across a lot of different issues at OEC.
Yeah, yeah. The inaction versus the action. I feel like often we're kind of framing things in sort of a maybe not positive as an optimistic, but like what is the reverse, the negative side of things? Yeah. Rob, what about you?
Of course, I love talking about cost benefit analysis, so I put that one. But I also am very interested in the legislative impact because I mean we're trying to do this kind of work so we can get it to policymakers so they can make better decisions. So I love hearing what Annalisa has to say about how this information is used, and I'm actually excited to see her talk a little bit about some of that after this break.
All right. Well, I think we've gotten all who will answered. And at 57%, we are at the highest for process of conducting a cost benefit analysis. So way to go, Rob. All right, y'all. I'm gonna share my screen again and pass it back to Annalise.
Awesome. Great. So, Rob put together this awesome cost benefit analysis for us that just had these crazy results. And we were like, okay, we have to get this out. Like, we have to talk about this and get this out to everyone we know. So we pitched the idea to Rep. Gerald's of let's go on a 4-day press tour and drive all around the state of Ohio. This might have been one of the craziest weeks of my professional career, but it was also one of the most rewarding at the end of it. So this was in September of last year. We kicked off at the State House in Columbus and had a really traditional State House press conference. At this point, the Lead Line Replacement Act, as we call our legislation, had been introduced for a few months, but the Ohio legislature goes on summer recess from about June until this time. It was after the election is when they come back. So we got our bill introduced right in time before they went on recess. And then we were like, okay, let's use the summer and the fall to make the greatest messaging campaign that we have ever seen. And so we went on our 4-day press tour. We pitched the idea to Rep. Gerald, as I mentioned. He loved it. And that's kind of what started it all. So we started in Columbus at the State House. Then the next day we drove up to Youngstown and held a press conference there. Youngstown ranks 25th in the country in terms of cities for their lead service line, which was something that really surprised us. In Columbus is actually 15th. So it's not just our state, it's all of our big cities. This is a really big problem here. So then day 3, we went up to Cleveland. And then day 4, we went all the way to the opposite corner of the state and went down to Cincinnati. Speaker wise, we had 13 different speakers within those 4 days. And that, isn't counting Rep. Gerald's 4 times. That's counting Rep. Gerald's once, yet he spoke at every single press conference. I spoke at multiple press conferences as well. We had 6 different elected officials also join our press conferences at both the local level with city council members and some other state level representatives as well. We also had 4 different organizations represented through speakers from our community-based organizations. Shout out to Junction Coalition, because I saw a couple of you all on here. Alicia did a phenomenal job when she joined us in Columbus. And so all the way from those community groups in Toledo to, our state level policy organizations to some regional bigger groups like Alliance for the Great Lakes. And we also had some community health officials come. That was a big deal. The Youngstown City Health Commissioner came and really spoke about, dealing with this firsthand and what she sees on her end of it. You can see there's a couple pictures. That top picture is our press conference in Columbus. The one in the middle is our last day in Cincinnati. And then also a picture from one of our boards. Everything that were on our boards that we brought on the press tour was just our fancy graphics around a lot of the information that was in that report. And then we did very specifically pull out the really big chart that Rob showed us earlier with all the amazing numbers in terms of the cases of ADHD and dementia that just won't happen now, to the cost savings and whatnot for our families and our communities in Ohio. People loved those. Reporters would go up after and take pictures of them and ask, if they can use them and such like that. So they were a great touch to our press conference. If we can go to the next slide, we can talk about some of the outcomes from our press tour. So our press tour was wildly successful. We had never done anything like this at OEC before, so it was a really innovative idea for us. We ended up making TV evening news in 4 major cities: Columbus, Cleveland, Youngstown, and Toledo, where we didn't even have to go. They just picked us up from a different city. We had 12 different articles written from around the state, cities that we did not go to. There was even an article out of West Virginia, just right on the border of Ohio, but our reach was that good. We also had one radio show podcast interview Rep. Gerald and I participated in through the Columbus arm of NPR, WOSU. And then we also put together a really thought out and intentional social media campaign. So you can see some of the different pictures of example social media posts and different graphics that we used to really explain that report in a snapshot. And then our reach was just amazing. From the 12 articles alone, our reach was 183 million. And so that doesn't necessarily mean 183 million people read the article, but it is believed that 183 times that headline at least was written. It was was read by someone. Our social media campaign reached almost 8,000 people on just Twitter. That was the only place I was able to pull those numbers really quick. So we know that our reach was even further than that. You know, this doesn't account for any of that TV time or Facebook and Instagram time also. I will just like personal antidote here. One of the best things ever after this press tour is I coach youth volleyball. And I was gone all week from practice, went to our game on Saturday, and one of my 8th graders comes running up to me and is like, "Coach, I saw you on TV." And I was like, "Okay," like, "No, you didn't." I'm like, "I don't know what you're talking about." And then her mom comes up to me and she was like, "We saw you on the news." And turned out it was all about this. And that's how I even found out we ran in Columbus on TV, which was awesome. And is definitely a highlight for just me personally that kind of came out of all this. So we really reached people that we would have never reached through our regular OEC channels. And so we really tried to diversify and put a lot of intentional time here. Next slide, please. So that was kind of everything with our press tour. So as I mentioned earlier, I talk about this report every single day, probably way more than anyone wants to hear about it. But every single day when I talk about lead, this report comes up. So anytime I'm in community or in lawmaker education meetings, lobbying for our bill, giving presentations, this cost benefit analysis is a focal point and something that people really latch on to the messaging around it. Our water in January, we had a water policy briefing at the State House where we covered a couple different topics, but when we talked about lead, this was a big part of my presentation for that too. We had over 50 lawmakers, aides, and fellows come to this policy briefing. Both Republicans and Democrats were in attendance, and we just had a lot of engagement there. After we had that briefing, we went and did, I believe it was a group effort of 12 lobbying meetings in the afternoon. And again, we've created like a 1-page executive summary sort of about the cost benefit analysis that was in every single folder that we gave out to every single person in attendance and every single lawmaker that we met with in the afternoon. So this has just really proven to be such an incredible messaging tool for us. Depending on who I'm talking to, sometimes this is what I lead with. Sometimes I lead with more of just the health effects and how this harms our communities, but it has really created such a unique and really expanded the messaging that we were able to do around this issue in Ohio. If we can go to the next slide. The most exciting thing I think that this cost benefit analysis has really produced for us is we officially have bipartisan support on our lead service line removal bill. So just a couple weeks ago, Representative Monica Robb Blaisdell, she's out of Columbiana County, up in kind of Northeast Ohio, kind of north, or kind of East Central Ohio. She has signed on to be the Republican co-sponsor of this bill. So now we get to go and, this is officially a bipartisan issue in Ohio. Given the makeup of Ohio, getting a Republican on this bill was crucial for us to get it moving and to get some real attention behind this issue. So we are so excited to have Rep. Blaisdell joining our team behind this bill. And get ready for reintroduction this spring. We are right now working on making some small edits to the bill and planning our next press conference, since now we have Rep. Blaisdell to bring that Republican perspective and really bring her colleagues and her constituents along on this with us. So all this just to say, this report has created such strong messaging for us and has really become a focal point of our whole campaign and anytime we talk about lead in Ohio. And it has made such a big difference in our advocacy. It makes it easy to talk not only to lawmakers, but also to community, and to be able to quantify some of these effects that could happen to them, to their children, to their loved ones. It really shows the urgency of this issue, especially in Ohio. I think that's my last slide. I will kick it back to you, Shelby.
Yeah, thank you so much and congratulations. Annalisa, I mean, press tour, volleyball kids, like what a journey, honestly. I love it. Um, yeah, well, we're about 15 minutes till the top of the hour. We have some time for a Q&A. We're gonna go through the questions in the chat that people have already asked first, and then feel free to raise your hand, come on camera, ask questions, put in the chat, whatever you feel comfortable with. And we'll just kind of get right into it. Yeah, I mean, I think I honestly have my own questions. But yeah, I'm really, really interested in a lot of things that y'all have talked about. First question is from Charlene. And Charlene, please come off mute if I don't get the essence of your question. But they were asking, is there a plan within like kind of the environmental aspects of homes that have lead paint, homes that are, from 1978 or older, and to do research about the children who are poisoned by lead paint. So, kind of looking at this is the drinking water sort of cost benefit. Like, is there a plan to do something with lead paint in older homes? And is that an issue in Ohio?
Yeah, that's definitely a big issue in Ohio too. Our older homes that have the lead service lines, a lot of them tend to have lead paint as well. Um, I do only work on the lead service line and the lead in the water side of it, so I'm not too sure if there is research in the work to do anything with lead paint. We do work in coalition with some lead paint advocates. And I have talked to them a lot about this and how much this cost benefit analysis has helped our advocacy on the water side. And so I do hope that if there's not already something in place, that this is something that they also look to for lead paint. I know in Ohio, there are a lot of lead paint abatement programs. I don't know that they are able to keep up with the need in Ohio. But there's definitely work happening, and I hope that they're doing some of that research too.
Yeah, Rob, you want to add anything? I mean, I guess I'm curious, would if you were to conduct something like that in terms of like a cost benefit, like would it be very similar in nature about like the process of how you went about the research, or would there be I don't know. I don't know how different like the data is on lead paint.
That's a good question. I mean, one thing is we had, Joel Schwartz and Ronnie Levin to stand on for this last one. So I think that gave us a lot of guidance. So I think we will want to see. I know that there has been some regulation that's been around lead paint in the past. So we might have some federal stuff to be able to um, base it off of. There is also a lot of good, research on lead paint exposure, what that does for IQ. So I know that that's an estimate. I think something that we'd um be able to draw off of. But yeah, I mean, I think these kinds of questions where it's like we can make an investment now and then we can have health impacts that will happen over a long period of time are perfect kind of questions to do cost benefit analysis on. And I'm not the kind of person who says every question is a good one to do cost benefit analysis on. I think there's some questions, when we're talking about questions of like, there's some like environmental justice kind of questions that, cost benefit analysis is not the right way to approach it. But when we're trying to answer questions about what economic impacts are going to be, cost benefit can be a really valuable tool.
Awesome, thank you. Okay, the next question is from Larry, Larry Levine. I know he's from NRDC. But he is asking, I think Rob in particular, can you explain the calculation of monetized impact of decreased water waste? Sort of what's the assumption about how much water will be decreased and by how much?
Yeah, great question. And really, when we were looking at this, we were less looking at how much use would be and more of waste from pipe efficiency. So we're worried about water that might be leaking in some of these old pipes. I mean, we know that the Safe Drinking Water Act was amended in 1986, And that means that and that was the last time they were allowed to put new lead pipes in. So all these lead pipes are at least 39, 40 years old, maybe older. By putting new pipes in, we're going to have better infrastructure in place. So it's part of just seeing this as an infrastructure bill and seeing it as something that's going to improve our infrastructure in general. Um, some of these, I mean, something that I think about with this is a lot of the things that you learn about cost through cost benefit analysis is not just that number you get at the end, it's all the things that you learn along the way. My benefit cost professor in grad school called the benefit cost ratio or your net present value your Fabergé egg. That's the exciting thing that you get at the end. But that's not the only important thing. I mean, I think about the number that we got when we were doing this, which is kind of a simple number. It's that 3.6 of the population of the United States is in Ohio, but 8.1% of our lead pipes in this country are in Ohio. That's something that I've heard OEC talk about over and over again. It's something that stuck with people. And that's not even a dollar figure number, but that's something that we learned through just going this process of doing a cost benefit analysis. And, at the federal level, when you do a cost benefit analysis, you're spending something, I mean, like the average cost benefit analysis on a big regulation is over $1 million. $1.3 million is a very standard EPA cost benefit analysis. We're doing this for five figures. And like it's not, just but it's by doing the process that you really end up learning things. It's by saying when you pull this policy lever, what happens along the way. And just by figuring out what happens what the different intermediate impacts are, that can often be the more valuable thing than that dollar figure that you get at the end. And that's definitely something that we saw throughout this process. I hope that
That's
answered the
awesome.
question, Larry.
Yeah, thank you. Yeah, Larry, put anything in the chat or go off mute if you want to add to that. But we've got a question from Aaron next. And I think it's for you both. Which of the quantified effects seem to resonate the most with policymakers and or the public or people you've talked to about this study?
In my experience of talking about this and, to lawmakers in public presentations and whatnot, the decreased water waste is the big one. And I don't think it's just because of the number. I think it's kind of what Rob was saying is it surprises everyone. They're just like, well, why would I use less water? And it's like, well, you're not going to use less water, but these pipes are really old and they're leaking. And I was talking to someone at a water utility recently, and they were like, yeah, I think the only thing that keeps these lead pipes in place and just even in a circular shape is the ground around them. And that water is really just flowing right through them. And that was something that like I hadn't thought through. Like, of course they're really old, so they are going to be more leaky. So we do need to also frame this as it's not just a health effect, it's also about improving our infrastructure too. And that decreased water waste is something that everyone's really interested in because it's, just not wasting our natural resources, but that's saved money for the utility and for the homeowner. So that's one really big one. And then I would say, and some of the health effects, people do get really surprised with the IQ numbers and just think that again is something you don't think through how it affects you long term. And so people that really resonates too.
Yeah, I love that. Something to really think about that water waste aspect, especially in places, going beyond Ohio to places where water conservation is really critical. Um, yeah. Larry, I see your hands up. Please go ahead.
Oh, sure. Thanks. I just put my follow-up in the chat also, but it's really interesting that that water waste issue is resonating when you talk about this with policymakers. Can you just elaborate a little more on how you quantified how much how much leaky water would be avoided and put dollars amounts to that? Both kind of what was the assumption about how much water is involved and what cost?
Honestly, if I wanted to get some like detail on what that was, I need to go back to Levin and Schwartz's and get a little
Okay,
bit
it's
more.
in there. Okay.
Yes, it's been a minute since I've like dug in on this particular one, so I don't want to jump too much on that.
Okay. Thanks.
No problem.
We love a technical question. No, yeah, that's Larry. I'm gonna put Rob and Annalisa's contact info so you can call
Yeah.
them.
And one thing we talked about too was like whether some of these impacts had more, because one thing is we're taking the federal, I mean like uh Levin and Schwartz's study, and we're trying to adopt it, like adjust it to Ohio. And some of these had to do with some of the other like impacts of the federal the lead and copper rule that might not apply here. So that's part of why we're doing the sensitivity analysis and saying like, okay, what if we just took water completely out of it and just said like, what if our pipes are just perfect and all these pipes that have been in the ground, for the past 50 years have not degraded at all and they're in really good shape? Like, what if do the benefits still outweigh the costs? And we still found that through our sensitivity analysis. So that was part of what we're doing is trying to say like, okay, the federal analysis is not going to look exactly like Ohio. How can we do sensitivity analysis to see where our limitations might be? So that's how we tried to adjust to like those kinds of problems.
Yes, thank you. Um, well, I think it's about time to start wrapping up, but one thing I wanted to ask, and just kind of a general opinion, and maybe this is a little bit more directed toward Annalisa, but like, what advice would you give to, organizations working in other states at kind of the state level? Um, people talking to their representatives, either in their state legislature or, talking to their representatives in Congress. Bye, Corey. Thanks for coming. Um, what kind of advice would you give to people in terms of like steps to take, partnerships, and just any kind of general big takeaways?
Yeah. I would say that, I mean, there's always strength in numbers, right? And getting those diverse opinions and those diverse outlooks. We, I can be the environmental policy wonk. And yeah, I have a degree in economics, but I can't do any of this that Rob just did. And so then, finding our partner in Rob who can do the economic side, and then then we have like our health partners somewhere else. And so really finding like your coalition of support with all of those pieces though that do match up. So one of the things that was really exciting when we were talking to Rob the first time was how he mentioned that like environmental stuff is just like a passion of his as a person. And so it was like, oh, okay, like I know that this report will be in good hands with someone like Rob because he just cares also. And it's not just a money, yes, it's, supporting his business and all of that, but it's not just about the money at the end of the day. It's about that, we're all working towards, a bigger and better world with these issues.
Yeah, thank you. I will also say to both of y'all's credit, you're very easy to work with, very responsive, very like ready to do it, ready to do the work, excited. And I also wanted to kind of use this as an opportunity to think about like, you know, these things aren't isolated. They're applicable beyond just one state, one situation, one representative, et cetera, or legislator. Water Week is coming up. I'm gonna put a blurb for that in the chat. April 6th to 12th. I know we've got some people on this call going. Erin Kanzig will be there, so if you are in DC that week, say hi to her. But yeah, I'm gonna go back to the presentation real quick and start wrapping it up here. Erin or Jenny, when I get to it, can you put the oh, you got it. You're so ahead of me, Erin. Oh my goodness. Um, okay.
I can also answer real quick if you want me to, Shelby, just on that
Yeah,
last.
go for it.
Yeah, just to say, I mean, like OEC went out there and asked the audacious question, what would the cost of doing nothing be? And that's a big credit to them. And a big reason that, I love working with OEC is because they ask these big questions and they're willing to go out and like get messy and try to find out what the answer to them are. So those are the kinds of like that makes OEC a really good partner for our kind of work because we want to answer big questions. And this was a great example of that and one that's going to have a big impact on people's lives. So thanks for
Yeah,
letting
I love that.
me.
I know. We love it. It's kudos all around. Okay, if you aren't already, and I know probably a few of you might have already come from it, but we have an online community. It's linked on River Network's website. It's really fun. It keeps you up to date on a lot of things. We have different pages for different topics, so please feel free to check it out. Um, and then we have a save the date, May 11th to 14th. Like I said earlier, in San Antonio, Texas, is our next river rally. Gorgeous graphic, really excited. We will be talking about lead. We will be talking about drinking water. I will be there doing something. I'm not sure, maybe running around, but please consider going. And yeah, fill out the survey. The presentation and some follow-up information will all be shared. And just thank you so much for coming and taking some time out of your day to learn about this. Again, it's been really fun to pull this together and get to be a little nerdy and talk about lead with y'all. So thank you so much. And we're on time. So I'm gonna give myself a little pat on the back for that. Thank you all.
Thanks, everyone.
Thanks. Yeah, and don't hesitate to reach out.